Hello everyone, I'm Dilshad. I'm the owner of IMD Association. Thank you so much for being the part of the channel. I'm very happy to say that we've grown up to a community of 250 subscribers. It is a dream come true, but I now aim to have 250K. Without much ado, let's get into the most requested video that has been CDM tips and tricks for QE1 exams. So I get a lot of questions on my Telegram group as well, how to attempt clinical decision making exam questions for QE1. For those of you who are planning to take an exam in 2025, you're lucky, you'll probably not be seeing CDMs in your exam section. But if you're aiming for November 2024, till that time, CDMs will be a part of QE1. As I was preparing for my exams, I used to feel like I used to have the scare about attempting clinical decision making because I was not sure that what counts as a correct answer, what counts as an incorrect answer, and why did I lose a mark when I chose like a right option. So there are certain rules and regulations on how you should attempt CDM questions in MCC QE exam, and I'm here to share with you certain tips and tricks that can help you ace this portion of exam. So let's get started. So I prepared this short presentation to for addressing what are the most common questions, how they present, and how you should be answering these questions. So as you can see on the screen, clinical decision making answering strategies. These almost all the material is available on MCCQE official website. So that's not my material, but that is available on the official website, and that is actually how they score you on the final exam. So let's get into it. So these are the questions which aim at problem solving and decision making skills. Basically, they want you to be like a general practitioner, and they want to assess how much of clinical information do you know. If a patient has come to you, what is the best investigation will you order for this patient? Question can come like, what is the gold standard of investigation? What is the investigation of choice? Something like that. Or they can ask you to make a diagnosis of a history that is given in the question, or they can ask you the treatment or therapy for that question. So your decisions should actually reflect the management which you would do to an actual patient. So basically they want you to think like a general practitioner, and I genuinely feel the entire QE1 is based on that concept. So in short, you are given like 38 case descriptions, and each question can have a sub question to it. For example, they may ask you to diagnose a condition, that is one question. Then they may ask you to how you'll treat this condition, then there'll be that second order question. And then the third can be what are the what are the side effects of that therapy, or what you would avoid in that patient, things like that. So that amounts to around 65 to 75 questions to those 38 CDM cases that will be there. So you'll be given enough time, 3.5 hours, to attempt this portion. And to be honest, I'll be honest, when I gave this exam and I scored a pretty good score of 290 on QE1, 290, I was pretty impressed that I finished this portion pretty early because I was confident, and I found it easier as compared to MCQ portion, which was the first part of the exam. So I feel that this is easier because you know what you have to answer in that question. So usually the questions can be short menu questions, they can be write-in questions, or you may be asked to match or choose the best option in the in the question options that you have been given. I have all the examples of what I'm talking right now, so it is going to make sense how we navigate, and how I will do that, how I'll progress with the cases. So what counts as an answer? So a 13-year-old girl has a 3-month history of intermittent diarrhea, weight loss, muscle weakness, despite increased and voracious appetite. She has experienced intermittent palpitations. Her parents report that her school performance has declined over the past few months. She also gets upset easily, is unable to concentrate, her sleep pattern is irregular. Physical examination detects a mild tremor of the fingers with the arms outstretched. Her palms are moist, and her blood glucose is 4.5 millimole per liter. So at this point, you are thinking of something which is connecting multiple systems. So you may be thinking in terms of thyroid, you may be thinking in terms of diabetes, you may be thinking in terms of liver disease, but you need to exclude all of that. But right now, at this stage, with diarrhea, weight loss, and increased appetite, with tremor, and all these symptoms overall, like of hyperactivity, are pointing towards a thyroid disease. So Then they ask you what is the most likely diagnosis, and they may ask you list up to three. So it's first thing you have to be sure. Just write the first diagnosis that comes to your mind and do not be under the pressure to fill all the three blanks that are written here. They are just written for you, but if you think you just know the single best answer, if that is the single best answer, just write that. If you're thinking of second or third answer, which might be your second best choice or third best choice, write that, but write the first option that you think is the best in the first blank. So the person will answer as hyperthyroidism or Graves disease, and when you answer accordingly like this, you're given 1 point. Make sure that you can answer hyperthyroidism, which can count as one correct answer, or you can answer Graves disease, which can also contribute to 1 point. But if somebody lists like three answers, or somebody can write hyperthyroidism slash Graves disease, diabetes, then liver disease, then renal disease, or say liver disease comma renal disease in the last blank, that is going to give 0 points. So one of the rules to crack CDM is stick to how many answers they have asked you. If they say up to three, just write up to three. Do not go over the board with writing the answer. So also, vague answers do not carry any point. You will be given 0 points if you write like thyroid disease, right? It doesn't indicate if it's hyperthyroid or if it's hypothyroid. So you need to be specific and very close to the scientific term that you're thinking that disease is. Coming on to the level 2 of this question, which initial investigations will you order at this time? Select up to three. Now, there might be so many options that I feel are exactly correct in these options. But when they've asked us to select up to three answers, you should stick to three or maybe less than three. Do not go overboard and think that okay, this answer is right, that answer is right, and you end up selecting four or five. And mind it, even if those four or five are right answers, you will be given 0 points because you exceeded the three option deadline of the question. So for these things, if you've gone ahead with thinking that this is a thyroid disease, obviously you think about doing serum TSH, you do think about doing serum T3 T4 for this question, so that carries 1 point. If you select more than three answers, that carries 0 point. And selecting, you can also think that this can be a symptom of maybe like vague symptom of pregnancy, or maybe even not pregnancy, because TSH molecularly mimics beta HCG. This might be due to increased serum beta HCG also. So it doesn't matter if you choose T3 T4, serum electrolytes, and serum beta HCG also. But if you end up choosing a fourth option, you'll be given 0 marks even though those options were correct. So some of the things that you need to keep in mind: please prefer writing full forms except for the universally accepted medical abbreviations. So OCPs is like a universally accepted abbreviations, but I'll be honest, in my exam I was super cautious of not using the short forms that I felt like are short forms to me but not to the Medical Council of Canada. So if you write OCPs, it's better that you spend more time and write oral contraceptive pills, because writing a full form may be just like a matter of 2 or 3 seconds, but it saves you that anxiety that will you be given full marks for this or not. So always try writing the full forms. And sometimes we are in a habit of writing ABC, like airway, breathing, circulation, in trauma questions. If you write ABC in one line, or you write airways comma breathing comma circulation in one blank, that is a vague answer, and chances are you'll be given 0 marks for that. Ideally, you should specify how you would secure the airway. You should specify how you will secure the breathing access by giving face mask, using 100% oxygen, and intravenous fluids or IV fluids or blood to restore circulation. So you have to be as specific as it gets. You need not be knowing the value or the concentration of fluids you are supposed to give. Just write like normal saline is acceptable, but what route of normal saline, like intravenous. If you're writing Tylenol, make sure you write per oral, not intravenous. So that mode of instilling the drug is very, very important. So you may not exactly know the dose of the drug, because then it requires us to know so many things. But QE1 does not accept that you should know each and every drug by heart, but make sure that you know some common doses like 500 milligrams of Tylenol, 200 milligrams of Advil. Not that it is super important, but sometimes in questions like PID, where you have to be really specific, it's preferable that you remember ceftriaxone dose or doxycycline dose and so on and so forth. So just remember few important diseases in which you need to remember the dose of the drug. I am planning to create a video on that as well, which are super important topics for QE1, and maybe plan a course for family medicine as well. But right now, coming back to that, please remember some important drugs for pelvic inflammatory diseases, pneumonia, STDs, because these are very high yield topics. And please remember, spelling should be correct. Do not mistake on spellings, because that will create a wrong impression. So this is another question, and mind it, all the presentation is based on MCC official website. These are not the questions that I created, but these are the questions that are there on their website. So there's a second question which says that at 20 hours, nurse in the emergency department asks you to see a 24-year-old woman who has two children and is now 31 weeks pregnant. She reports of bright red bleeding from her vagina, which began 2 hours ago. She used 3 sanitary napkins which have been soaked, and she has not had any belly pain, and she says fetus is moving normally. So I'll discuss with you in future videos on how to attempt a question, but right now you should be cautious of making a diagnosis that this is first antepartum or third trimester bleeding. Second is there is no pain that is mentioned. So we know that in antepartum hemorrhages we have placenta previa and abruptio placenta. So placenta previa is something which is painless bleeding. Patient finds herself lying in the pool of blood, but there's no pain. Whereas antepartum, or which is abruptio placenta, that is associated with pain, because placenta is almost all of a sudden, like, it abrupts from its site of implantation. So as a result, patient experiences pain. So her BP, she's stable. The BP is 110/70. Pulse is a bit high. Abdomen reveals a uterine height of 31 centimeters, which is concordant with the weeks of gestation, and non-tender uterus. Fetus is in breech position, heart rate is 150, no bleeding has occurred since she arrived. What is your leading diagnosis? List only one or write normal if you judge this situation. In any case, you should refrain from writing normal, because this is far from normal. So you're thinking of third trimester bleeding, right? So right now, the consideration in diagnosis is placenta previa, which is the leading diagnosis. Okay. I'm sorry, I just skipped and the previous slide, and I don't seem to go back on the slide, but they had the options that you will be doing for this patient. So if we end up choosing the option that is associated with harm to the patient, that is going to give you 0 points in the exam. So in that question, I can tell you the options were: how will you manage this patient? The options were doing an ultrasound, pelvic examination, fetal electrodes, and doing pelvic ultrasound and doing abdominal ultrasound. So as you can see on the screen right now, we have to consider placenta previa as the leading diagnosis, and we have to avoid doing pelvic exam. So if a candidate ends up choosing pelvic exam as an option for a low-lying placenta, the patient can bleed to death, and that is a harm answer. So it doesn't matter if you choose other two options as right answers, but if you choose one harm option, you will end up getting 0 points. So we do not discharge the patient because this is an emergency. We order pelvic ultrasound to confirm placenta location. Transabdominal ultrasound can also be ordered for this patient. So the criteria and the score key according to which MCC grades a candidate is that they will give 1 point if you did not select pelvic examination, or you did not select the pelvic examination, which means that that was a harm to the patient. So if somebody ends up selecting artificial ruptures of membrane, cervical swab, insert fetal scalp monitor for assessing fetus, pelvic examination, or selecting more than 6 items that they had written in the question, they'll be given 0 marks. So if you think about it, this is a low-lying placenta, and if you choose these options, you are directly causing the placental bleed, and the patient may bleed to death, and it can cause fetal exsanguination. Hence, do not go for harm options or invasive investigations. Then the second is you do not discharge patient home in this scenario. So that is the thing. And the third is that you ended up choosing the right option, which is pelvic ultrasound, but there is zero marks for using any vaginal probes or selecting more than 6 items. So I hope it makes sense to stick to what they have actually asked you and not go overboard with the number of options that they have asked. This is a third question. A 20-year-old nulliparous diabetes type 1 female comes to your office to discuss complications of pregnancy. So they can ask you what are the maternal complications of type 1 diabetes in pregnancy, list up to 4. If they've asked 4, we will write only 4. Do not exceed to 5 or 6. And also make sure, do not say like, GDM or IDM, or it should be infants of diabetic mothers. Don't use that kind of small short forms. And they can also ask you what are the fetal complications of pregnancy. So list up to 2. If they've asked up to 2, just write up to 2. So examples of test questions can be uh, elements of history that you want to gather. What focused questions will you ask from the patient? What features and history will you look at this time? So they have given you the examples of test questions that can be asked on history and physical examination and diagnosis. Mostly I have seen, and I take regular classes as well, and I mentor candidates as well, and I tell them that diagnosis and treatment is the most important part. Sometimes history and physical examinations are important, but mostly the questions are framed from diagnosis and treatment part. So investigations are very important and management is also very important. So on the screen you can see there are like few examples of how the questions can be formulated on the basis of management and investigations as well. So there are certain things that one has to keep in mind. Make sure that if you are using a universally accepted abbreviation like DVT, which is deep vein thrombosis, that is acceptable. But if you just say like pain in the leg or something, some weird response, that means that they will probably give you a 0 mark. So you should be as specific as you can. So in the questions, they may have patient with history of seizures also. This was one of the questions on the official website where they talk about the patient with history of multiple seizures. So the patient has regained consciousness and they ask you to choose what things in the history will you ask the patient. So they said select up to 4 or 6, but if you go above that, then they are given 0 marks. So similarly like this, they can give you a case scenario, which is like a 56-year-old man in the outpatient clinic because of pain in his left lower leg that began 2 days ago and has been getting worse. His ankle is swollen. He's never had a similar problem. His other leg is fine. So it is the same answer that I just discussed. This is DVT. We are thinking, you may think of you may think of peripheral vascular disease, but that would be the second diagnosis because right now DVT seems like the most appreciable response at this time. So with respect to your diagnosis, what elements in the history would you want to elicit? So if they say up to 7, stick up to 7. And obviously we all agree up to 27, that is not like no other information is needed. We do need to know whether the patient has traveled recently or not. Is the patient on any coagulant therapy or not? Has the patient been underwent under any surgical procedure or not? Is the patient immobilized or not? Is there any history of surgery that has been there? Any recent work environment? So all these things we need to ask in the history of, and no ways we will choose this option as no other information is needed. So again, the same things, that given that the patient has a history of DVT, smoking is the one that predisposes to this condition. Malignancy is one of them, recent travel, immobilization, recent surgery, or work environment. If the candidate ends up choosing more than 6 items that have been written in the question, then that means they will be given 0 marks, and that is how their key is marked here. Coming on to another question, they say a 36-year-old man was brought to emergency by ambulance. He fell on a sidewalk, unconscious. A witness called, and the patient had jerky moments during 10 minutes. A patient presented with similar episodes. His temperature is 37.8. He looks neglected and is unconscious. So, leading working diagnosis. Leading means that one of the things that is coming to your mind is this seems like a case of status epilepticus. So, you may think of that as the first one. And the second, if you think like, okay, this is delirium tremens or these are alcohol withdrawal seizures, that is fine. The first thing is the diagnosis is status epilepticus. Then management at this point, obviously this is like a trauma case. You think of airway, breathing and circulation, but also you need to give the therapy for status epilepticus. That means you'll have to think in terms of diazepam, phenytoin, anti-epileptic drugs which are used in emergency scenario. Make sure that you mention the route of administration of these drugs along with the answer. So IV thymine, IV hypertonic glucose, and IV lorazepam. So if you think their official key also shows IV, must mention intravenous, must mention intravenous. So that's what they have written all the time, and they accept different names. If you write lorazepam, you are right. If you write diazepam or clonazepam, Ativan, whatever, that is acceptable. But IV has to be written. So after that, the patient is still unconscious. Then you are going through that history, and somebody picks up his phone. What things would you want to ask them? So select up to 6 and 33 if you think it is not appropriate to call at that time. If you end up choosing 33, you're gone because that is a zero option. You should not choose that. We need to know a lot of history, whether this patient has any alcohol history, drug history, diabetic history, medication history. That those are the most appropriate things. It's okay if you can't choose up to max 6 options. You can choose up to 3 or 4 you are sure of, and you'll get the full credit for that. So it's been, then this is a four stage question for that question, and they say that now the patient has still, it has been 15 minutes. What other things that you want to do? So now the thing is that the patient has not regained consciousness. So you are thinking that because of such a long history of seizures, you are thinking that patient might have entered into metabolic acidosis. So ABG is required. It is important to screen the brain of the patient, so you'll do it with brain CT scan or MRI, and also check for calcium levels as well. Drug screening is super important, and serum electrolytes as well, and glucose serum. So if somebody ends up choosing no investigations at that point, then it is a zero score. So I end this video by just some takeaway points on how to attempt CDM questions. So first thing is, please make sure that QE1's official website has a lot of CDM practice tests and full length assessments. Again, I'm not promoting the official website, but I found those official exams pretty useful. They're a bit expensive, but they give you the exact idea of how the exam is going to be, how the final exam is. So it gives you a feeler of how you have to attempt CDMs. And also there's an answer key in case you want to know how you were marked. Know your syllabus inside out. That's a second tip. And answer to the point. Be very specific. Don't forget to mention the route of administration of drugs, and do not use a lot of medical abbreviations. Try writing the full forms. Be careful on the spellings, and just remember the normal doses of some of the drugs, such as for STDs, PIDs, and pneumonia, and do not attempt more options more than you've been asked. So I think that became like quite a long video, and I'm sorry for that, but I hope you find this helpful. And if you think the content is helpful, please consider subscribing to the channel and following me. And I hope to make such valuable videos so that it helps you ace both QE1 and USMLE the exact way I did. Thank you and have a good night.